National awareness of mental health issues are increasing as the number of people qualified to treat the problems decreases. Over the last 20 years, the number of psychiatrists available to the general public has dipped significantly. WSLS 10's Bethany Teague finds out what it means for Southwest Virginia.
In many cases, people have less access to mental health care than they have before, particularly in rural areas.
Most people do not want to practice in more of the remote or small areas.
The number of practicing psychiatrists is steadily decreasing, not just in rural areas, but all over the country.
There are not as many open points of access as one would hope to mental health care.
According to the American Medical Association, the U.S. population has grown by 45% since 1995, but the number of psychiatrists has grown by just 12%.
There is growing, let's say, frustration with reimbursement for mental health services.
Only about 4% of medical students are picking psychiatry as their specialty, perhaps because the field earns 30% less than most surgeons and well under what general practice doctors make.
It's really important to help patients access care as quickly as possible before problems reach a point where there's a crisis.
But unfortunately, many cases escalate before preventative care can happen, due in part to lack of resources. This puts more strain on what are usually already thinly stretched police forces.
Law enforcement professionals are on the reactive side, and we would all hope that there would be more opportunity for proactive care.
In Virginia, there are fewer than 9 psychiatrists per 100,000 people. 8 per 100,000 is the national average. The forecast shows that ratio will likely continue to decline.
That's a really low number, and it doesn't seem to be replaced or being replaced.
And today, Virginia Tech announced it is launching a journal in the field of computational psychiatry. This will team up clinicians and computational neuroscientists to form what they call next-generation solutions to mental health problems. In Radford, Bethany Teague, WSLS 10.